But if it's like a really severe, the light's really bothering you, you start noticing like one side of your body's a little bit weaker. Those are some of the signs that would, more like red flag signs that would make me seek evaluations immediately.
Welcome everybody to the Doctors for Accidents Personal Injury Show. I'm your host, Jean-Paul, and I'm sitting here with Nicole, our co-host.
Hi guys, good morning.
And guess what, guys? We have a special guest, a pain management and board-certified neurologist. Everybody please meet Dr. Hirsh Kaveeshvar.
Hey, everyone.
Hopefully I said your name correctly.
Yep.
All right.
That was pretty good. That was pretty good.
That was very good.
Yeah.
And Dr. Hirsh is actually a pain management and a neurologist, and the facility name that he has is called Synergex Medical Group. Is that correct?
Correct, yeah.
Perfect.
So actually I want to ask a couple questions about Synergex.
Yep.
What are the locations and how many locations do you have?
So Synergex, we first started off in Orange County, and now we've sort of expanded up north to San Jose, which is actually getting really busy. We're in Westlake Village. We have a satellite office there. And then one of the more recent developments is we're actually expanding to San Diego as well.
Oh, wow.
Yeah.
Great. And you are also out of state as well?
Yes.
Or you're working on it?
We do have an affiliate in Arizona, in Scottsdale.
Very cool.
Yeah.
Wow.
Yeah.
I like Arizona. I don't know why. I know you don't feel the same way, but...
What are you talking about? I love Arizona. I grew up out there too. Tell me I don't like Arizona. Arizona is beautiful, by the way. It's very nice. So are you originally from California? Did you grow up here? What's your background story?
So I was born and raised in Detroit, Michigan. I did all my training out there as well, including medical school, including residency, fellowship. I've always sort of had this California dream growing up.
Okay.
If you're not from California, you kind of know what I'm talking about. People always think of this place as like an enchanted place. And then furthermore, I had the opportunity to learn from and join this fellowship in sports neurology at Kerlan-Jobe over here, which is in LA, and be under the mentorship of one of the leaders in this field named Dr. Vernon Williams. And so I came out here in 2017, and then ever since I came here, I decided to stay.
That's amazing.
Yeah.
And what inspired you to become to become a pain management and also a neurologist?
Double board.
It's interesting. So when I started medical school, I had no idea what I wanted to do in terms of a specialty. I actually found medical school very difficult in the beginning, and I remember I used to think of different ways to almost like be smarter or think better, and so that kind of triggered an interest in neurosciences and our cognitive abilities. That was what led me to go into neurology, and I really appreciated sort of like the logical approach neurology offers. A lot of what we do is we look at the human body and the mind as like a circuitry, and when people come with symptoms, we try to take a step back and see where in the wiring did something go wrong. So we're very diagnosis heavy, and neurologists were very good diagnosticians, so we're able to come up with proper diagnoses and treatment plans based off of that. And then pain management, on the other hand, sort of provided me that sort of like art of medicine, because there's so many different things we can do. Some things work for some patients, some things don't. It also kind of aligned with my interest of helping people sort of live their best life instead of necessarily curing disease. Pain management afforded me more tools in my toolbox to allow that.
Wow, that's great.
That's amazing.
Yeah, that is.
So I kind of wanted to talk about headaches. Someone that's experiencing a lot of headaches, what are your kind of treatment plans, especially the ones that are like the base of the skull, kind of neck tension? What are some treatments that you would perform for that?
Just to take a step back, when people say headaches, it's a very broad term.
General.
Right? Yeah.
General.
And most physicians, aside from neurologists, will just think headaches are headaches. But the truth is like, and this is one of the advantages, I think, of seeing a double-boarded pain management neurologist, is specifically for headache management. And so what we do is we take a step back and we look exactly what is that diagnosis. There's very specific criteria for, say, migraines or cluster headaches or cervicogenic headaches, which is probably what you're referring to. And so once we get to that diagnosis and rule out other maybe more emergent things that a headache can symbolize. Then we look into, usually some sort of medication management, some sort of like physical therapy regimen. And then where I come in as an interventionalist, then I can also offer different kind of interventions, whether it's nerve blocks, nerve burning, sometimes Botox for migraines, for example. One of the things you just mentioned is a very common headache that people get after whiplash. Mm-hmm. And there's actually, the top of our spine has these little nerve roots coming out of the cervical spine, and they actually come up to the top of the head. And so when you get a whiplash injury, those nerve roots get stretched and irritated and inflamed. And so a lot of times what we can do in those kind of headaches is actually use live x-ray, go down to where those nerves are and block them and even burn them in something called the radiofrequency ablation, and give some pretty long-lasting relief from that.
Oh, wow.
Amazing.
Yeah.
And let me ask this. I mean, how do you identify, for our audience, like let's say someone falls and hits their head, let's just say like a forehead, or, because you can't see it in the hair, right? But like a forehead, like is there a way to identify without imaging if somebody has like, brain bleed, I believe it's called?
Like a hemorrhage?
Or like a hemorrhage, yeah.
Yeah, so you can't necessarily say for sure if someone had a brain bleed without imaging. Right. It's sort of a diagnosis. But what you can do is you look for different signs of either progressive deterioration in like the mental status, or different sort of focal neurological deficits. For example, if you have a dilated pupil or something like this, and as neurologists, we're really trained to observe people. So I remember one of my mentors told me, to be a neurologist, all you need is a hallway. And what she meant by that was that you can observe so much in someone's neurological status by just seeing them walk and talk. No, we can't necessarily 100% this is a brain bleed or a stroke, but there's different clues in the symptoms that suggest that.
Got it.
Yeah.
Thank you.
So when it comes, I'm just going to bring it up, because when it comes to older people, especially with strokes, this happens quite a bit. Even an older person will just slightly bump their head and they'll think it's okay. Like this actually happened to my grandfather. He just slightly hit his head on the car, like nothing extravagant or anything. And that evening, like around 1 a.m., he ended up getting the signs of stroke and ended up having like a pretty severe stroke. Right. So what would you recommend for older people if they just slightly hit their head or hit it pretty hard?
I think, a lot of that depends on if they're on blood thinners or not. I'm not sure if he was on any blood thinners, but yes, you do have increased chances of having intracranial hemorrhages, which is what it sounds like probably happened to him when you're on blood thinners, and a lot of older people are on blood thinners. So that's why I think preventing falls is extremely important, and preventing any kind of like tripping and all that. So I think like good rehabilitation, keeping active throughout your entire life and even when you're older, is really important.
Yeah, absolutely. Yeah, that's scary as you get older. I mean, it's like, things just start happening, and that just reminds us that we're immortal. Yeah. We're only here for so long, so enjoy it.
Yeah.
So if you could share some insights on the latest advancements or emerging trends in neurology and pain management that you find promising, what would they be?
Yeah, so I think, especially in the neurology front, one thing that's really exciting is that there's now FDA-approved headache-specific medications. And so what that means is, before these medications came out, called CGRP antagonists, before these medications came out, we used to treat headaches with medications that were sort of designed for other things, like whether it's epilepsy or antidepressants. They tend to work on headaches as well. So these medications, these new class of medications, are very, very specific to headaches specifically, with very minimal side effects. Wow. And so that makes it really encouraging for people who suffer from headaches. And as far as the pain management side of things, I think one of the things that's sort of always new and up and coming is some of the neuromodulation or spinal cord stimulators and things like that we do. The technology is just getting better and better and better. The batteries are getting smaller and smaller and smaller, and they're using different kind of like wavelengths and energies and things like that. That's been actually very exciting to see the technological advancements.
Yeah, absolutely.
Yeah.
So when it comes to medications and procedures and everything, I know some people just kind of like to go the natural way.
Yeah.
Can you tell me about a little bit of holistic treatment and your involvement with holistic?
Yeah, so I do have, I would say like about 30-40% of my patients are like, hey, I don't really want to take any medications, but I would rather have more holistic options. So one of the things I caution, a lot of it comes down to education. Patients will come to me and be like, hey, I heard about this supplement or this, whatever therapy. These things are usually cash-based, out of pocket. So I'm always like very like, hey, like these things might help, but here's what has the best data. And so I'll usually have like a list of different kind of supplements for different kind of issues and specific dosing, because that's the other thing people forget about is that you can take the supplement, but it has to be the clinically relevant dose to actually be working. So that's one approach I have, is different kind of supplements and things like that. But from my experience, one of the best things I can do really is just educate the patient on their condition and why it's happening and why certain behavioral changes would actually help, whether it's like stress management, optimizing sleep, nailing your nutrition. Because once you have an understanding of how that stuff impacts your neurology or pain, you'll start naturally making healthier decisions. You'll start naturally eating less processed food. You'll start naturally wanting to manage your stress because you know the underlying reason.
I see.
Yeah.
And let me ask you this, kind of off topic a little bit, but with motorcyclists, every time I'm driving and I see a motorcyclist pass by, I always think to myself how I wish I could get on a motorcycle, but I probably somehow something bad would happen. So I tend not to do that. But with motorcyclists, when they fall, do you think, like, how do you treat, do most of them have head injuries from a fall or from an accident?
Yes. I mean, I wouldn't necessarily say it's any more frequent than a car accident, for that matter. But yes, I mean, a lot of them have some pretty nasty injuries. Actually, I would say, like, whenever I get a motorcycle accident patient, I mean, the list of injuries they have is usually it's like, huge.
Yeah. 10 times more than a car accident.
Exactly. And with obviously typically a mild TBI as part of that, or headache disorder or something like this.
Yeah, I'm sorry. The only reason I was bringing that up is because the other day on Instagram I saw that one of these companies brought or has like a airbag for motorcyclists now, and
I've seen those.
It blows up.
It blows up right when you land. It's
right.
actually pretty cool.
That's
interesting. Yeah. I wonder how that would work though, because like it just seems like you can fall wherever.
Yeah,
I think it feels like a momentum or a jerk, and it implodes like as quickly as an airbag. But it's like covered the neck and the shoulders, and there's actually a suit now that has the same thing. So once it feels a tiny bit of impact, it will.
That makes sense to me. The suit.
Yeah. That's pretty crazy.
Yeah.
So I actually wanted to ask, like, number 5.
Oh, yeah,
number 5 is a good one, since what we were talking about. Can you share any specific patient stories where you combined interventional pain management and neurology?
Yeah, one case comes to my mind actually recently. There was a patient who had actually electrocution injury, and they fell. So they had like orthopedic complaints and all sorts of strange sensory issues and pains. This patient saw an orthopedist at first and had some sort of orthopedic surgery. I can't remember off the top of my head right now, but then afterwards they also saw a pain management specialist. This patient was really complaining mostly of this like terrible burning electric like shock pain constantly around his ear and on the front of his face.
Right.
And you can imagine that would be very annoying and disrupt your
of course.
living. Because some of these other doctors were not necessarily trained in neurology, not to say that they're not competent, but they're just not necessarily thinking the way I'm thinking.
Right.
They tried injections, spinal cord stimulators, and like just nothing seemed to be helping, and no real medication management either. And then the first visit they saw me, again, to our point earlier, I first took a step back and I was like, okay, where in the electric circuitry of our neurology is that pathology coming from? What kind of headache or facial pain disorders does this most closely characterize with? And then I started him on a very specific medication called trileptal, which is like a seizure medication, and it has to be dosed very nuanced. Mm-hmm. And so we started him on that, and boom, his facial pain just completely went away. Wow. And that was probably his primary concern.
Yeah. So I'm very curious now, with being electrocuted and sending like all the energy pretty much through your body, that could really affect the brain. Can it?
And the nervous system.
I know we use it, like if someone has a heart attack or something, to like use, I think it's called a defibrillator.
Yeah.
And they do that to kind of restart the heart. which is pretty much shooting electricity. But what if that were to happen to the brain, or like if being electrocuted directly through the like touching something with your head compared to your hand?
The research on this is very scant, I would say. There is some articles and publications out there that speaks to this, but the problem is people with electrocution injuries typically complain of like burns, and then when they talk about their neurology symptoms, it's usually like very vague, non-specific, difficult to characterize, and a lot of it has overlaps with like psychiatric issues as well. And it's interesting because when people are really have severe depression, one of the treatments for that, or one of the ways to help manage that, is something called ECT, where we literally shock the brain while the patient's under anesthesia to sort of like reset some of the neurochemistry. So there does seem to be some interplay between electrocution injuries and affecting perhaps some of the neurotransmission. What exactly that is, we don't know.
That was a big thing in the 60s. For postpartum, they would put women in and do the electric shock therapy for it, thinking that would solve postpartum.
From your experience after 2020, I know the pandemic changed a lot of stuff, and it kind of forced a lot of clinicians or physicians to do telemedicine.
Yeah.
How do you feel about it?
Yeah, this is a topic very near and dear to me because I'm just a very big proponent, number one, of telemedicine. And so when we started, me and my partner, Dr. Shah, when we started Synergex Med, we actually started in July 2020, so it was midst of pandemic.
That's right.
It wasn't exactly the most convenient time to start a medical practice. Because of that, no one was really seeing anyone in person. So we started telemedicine first, and thinking that whenever this thing ends, like maybe we'll open up to in person and things like that. So that we just basically dove right into it, telemedicine, and then over. In neurology, telemedicine has actually been around for a long time, especially in the more like rural cities and of the country. A lot of the stroke management, which is like one of the most acute things and one of the most emergent things in medicine that can happen, a lot of times that's done over telemedicine. And so what I mean by that is there's usually like a robot or some sort of camera in the ER, and there'll be a neurologist on the other side of things kind of evaluating things and determining whether we administer this life-saving medication called TPA or not. A lot of people think like, oh, well, how can you manage or how can you evaluate patients through telemedicine? And a lot of times my response to that is, hey, we're managing really acute, like on the verge of some catastrophic injury patients through telemedicine. So you'd be surprised at how much we can do through telehealth. And, one of the things I like about it is it provides access to a lot of people. It provides ease of scheduling. You try to make an appointment with one of these bigger centers. You're usually waiting for a long time. You drive, you pay for parking, you sit in that waiting room. The doctor's always late, and it's super inconvenient, right? And then you're in with that doctor, and you're in it for like 5 to 10 minutes. Whereas what I like about telemedicine is what I've noticed, and I think a lot of physicians have noticed, is we actually spend more time with the patient, because we're not feeling rushed. There's not like a busy waiting room. And so I just think overall it's a better experience. I think there's a lot of good data from a lot of consulting firms that show that results aren't really different and patient satisfaction is very high. So I think now the government and Medicare have really adopted it due to the pandemic. It's really accelerated things.
Yeah.
Yeah.
It definitely, the old way, you get the ripple effect. If one person is like 10 minutes late, it keeps on.
Yeah.
Everybody then is 10 minutes late, 10 minutes.
Right.
Yeah, it's not fun. So my question though is, when you're trying to diagnose someone and you're doing, say for instance, a telemedicine video, how, like, to analyze someone's eyes, say for instance, if someone comes in with a concussion, which I want to speak about, if someone comes in and they have one pupil that's dilated more than the other, how do you really visually check a person and making sure they're okay and they don't have any kind of neurological disorder?
So to be honest with you, you're not going to be able to check pupil dilation probably unless someone's on the other side of things. And Right. That being said, pupil dilation and things like that, these are usually acute issues, and so by the time they see me for like a follow-up like a month later or like 2 weeks later, that situation has resolved.
Okay.
So that's number one. Number two is, like I said, I can observe a lot just by looking at patients. So like, if there's like a little bit of a droop, if they're discern how the cadence when they speak, different things like how they tap their fingers, is there any rigidity, how they get up from a seated position. Do they need assistance, or can they just get up regularly? Can they walk on their toes, walk on their heels? I mean, these are some of the things that provide me a tremendous amount of clues as to like what's going on and the severity of the situation.
Got it.
Wow,
Yeah.
that's interesting.
So I actually want to talk about some side effects that you would look for during a concussion, because I know a lot of people are injured in a car accident and you're just so scared at that point. Your whole body is just full of adrenaline. And it's not until you get home you realize, like, oh, okay, these things are wrong. What would you look out for that you would go to a doctor specifically, especially with any kind of damaged brain or neurological
concussion.
issues? So
Yeah.
what are the specific signs?
Yeah, so I think if you have a really severe headache, I think it always, in my opinion, warrants imaging of some sort, because I have seen a few cases now where people just try to ignore the headache. They're like, oh, it's just a concussion. I mean, there's a difference. Like, I would say a lot of people have like this mild kind of dull headache a lot of times, and that's probably not concerning. But if it's like a really severe, the light's really bothering you, you start noticing like one side of your body's a little bit weaker, those are some of the signs that would, more like red flag signs that would make me seek evaluations immediately. A lot of the stuff, though, is what's considered normal, especially in the first 3 to 5 days of the injury, which is like, brain fog, a mild to dull headache, difficulty with vision, things like that. Also, the other thing I would say is not blurry vision, but double vision. So there's a difference. So blurry vision literally means if you see two things side by side or on top of each other. So I think if you start getting double vision, that's another sign that I'd be want some evaluation.
All right, so I have another question for you. Did you always want to become a physician? Like, what's your story behind it? Because I know kids growing up, they're always like, oh, I want to be this.
Yeah, maybe it's an
Or
inspiration.
something happens in their life which makes them then in turn become what they want for their career.
I actually originally wanted to be an architect.
Cool.
And so I was really interested in architecture and urban design and things like that. But in college, I had a roommate who was pre-med, and he was very like interested in it, and so then I remember just like hearing about some of the classes, and then I volunteered at a hospital, and there was just something really appealing about like seeing that doctor come in that office and provide that reassurance to that patient that just kind of really spoke to me. And so I didn't necessarily know what specialty I wanted to do. I just knew I wanted that feeling, and so like that's what made me pursue medicine, I guess, in the beginning.
Yeah, helping people always feels good.
Are you the first physician in the family?
No, so that's another influence. So my father is also is a gynecologist, actually.
Oh, cool.
Yeah, he's retired now, though.
Great.
Yeah.
Wow.
Yeah.
That's awesome.
That's
Yeah.
really cool.
All right, guys. Well, thank you so much. This is Dr. Hirsh Kaveeshvar with Synergex Med. Thank you so much for coming on to our show.
Appreciate it.
Yeah, absolutely. It's been an honor.
Thank you.
We can't wait for you to sign the wall and get a picture of you.
Awesome.
And we hope to see you soon with more information. We love having you here.
To have you back on
Definitely.
the show. Yes.
Yeah.
Thank you, guys.
All right. Don't forget to like, subscribe, and share this video. Thanks, guys.